Good afternoon. It's a pleasure for me to stay here. I am Martina Andellini. I'm a biomedical engineer and I work in Health Technology Assessment Unit of Bambino Gesù Children's Hospital in Rome. I'm also a PhD student at the University of Warwick in UK and IFMBE Health Technology Assessment Division collaborator member. The work I'm going to present is hospital-based health technology assessment study about the implementation of a decision-making support algorithm for the active implantable medical devices evaluation. So this is the agenda. So we start with an introduction on what health technology assessment is and the critical issues, as Professor Clark mentioned before, related to the medical devices assessment, the objective of our study, materials and methods, and the expected results, because it is an ongoing study, and the preliminary conclusions. So let's start on what is health technology assessment. We can consider health technology assessment as a bridge between science and policies. It means that it could be considered as a link from evidence about the safety, the clinical effectiveness, the cost effectiveness, the organizational aspect of health technologies, and the decisions about the technology. So the decision based on evidence, and decision that should be at different level. So macro level, for example, it refers to market authorization. Meso level to the adoption of health technology within a clinical setting. At a micro level, the everyday use of health technology in clinical practice. So in 2006, a European network of health technology assessment was established in order to provide a methodological framework for the production and sharing of health technology assessment information, and they produced the health technology assessment core model EUNETA. It is this model provides detailed explanation on how to carry out a health technology assessment study, highlighting the main area, the main domains should be considered when we evaluate a health technology. And these domains are health problem and current use of technology, description of technical characteristics of technologies, the safety, the clinical effectiveness, the cost and economic evaluation, the ethical organization, social and legal aspect. However, even if they produced a model for diagnostic technologies and for surgical intervention, the model for the medical devices evaluation is currently lacking or is still ongoing. And as you know, the global market of medical devices have been growing over the last years, and it is expected to significantly grow for the next years. So in 2016, with the IFMBE Health Technology Assessment Division Working Group, we started a project in order to define method and guidelines for medical devices assessment. And as Professor Clark mentioned before, we identified the main issues affecting the medical devices assessment, highlighting the short life cycle and the clinical effectiveness and performances that are strongly dependent by clinical setting and by learning curve and user's experience. So, our study, hospital-based health technology assessment study, focused on a particular class of medical devices, which are the highest risk medical devices, the active implantable medical devices. So the aim of our work was to develop a rigorous and reliable decision-making support algorithm for the the assessment of active implantable medical devices, including the definition of the evaluation criteria and of the method for collecting evidence in order to evaluate their performances and to select the most suitable patient-specific model. As there are a number of different devices and they differ in their technical characteristics and functionalities, we decided to start our study with a case study focused on one of them. So we decided to focus our attention on cardiac defibrillator and pacemaker, which are the most spread active implantable medical devices in Italian market. So our study started with an evidence gathering. We gathered evidence as a first step from PubMed, carrying out a literature review, and we would like to gather evidence on efficacy, effectiveness, cost and economic evaluation, organizational aspect, and so on, and all domain outlined in the UNETA core model. The second step was the safety analysis. So we taking into account the FDA mode database, and we identified all the type of adventiverse and the number of adventiverse related to the pacemaker from different manufacturers from 2014 to 2018. And the third step was the analysis of the technical characteristics of technology. So we consulted the manufacturer data sheet as well as the comparative table of technologies provided by ECRI, which is a table which describe a number of different pacemakers from different manufacturers with respect to a number of technical characteristics. So putting together all the information gathered, we build a decision hierarchy structure. So starting from the problem of the decision, we decompose the problem into its constituent parts. So we define at the first level the criteria, the domains, which are the most suitable domain for our specific context analysis single out in the UNETA core model. Each domain is then described by a number of criteria which are identified from the IFMBE Technology Assessment Division study, as I told you before. And finally, each of these criteria was described in turn by a number of key performance indicators that are specific for the technology under evaluation. So, and these key performance indicators are defined from literature review, safety analysis, technical characteristics analysis, and expert opinion. This is only to show you the decision hierarchy structure. Okay, at this on this step, we starting from the all the key performance indicator defined, we extracted the main pacemaker technical characteristics. So we defined 21 pacemaker technical characteristics, and we built a database taking into account, as an example, the comparative table provided by ECRI, and we are now collecting all the information about all pacemakers currently available on the market, and we are describing each one with respect with these technical characteristics we identify from our analysis. At the same time, from the clinical point of view, as we described the device with a number of technical characteristics, with the help of physicians and cardiologists of our hospital, we define the technical characteristics of the patient, the clinical characteristics of the patient, both physical and pathological characteristics of patient. So now we have two sets of variables. The one referred to the patient, the second referred to the pacemaker. And with the purpose of our project is to model through a mathematical approach the everyday decision-making process made by physicians and cardiologists in the selection of the patient-specific pacemaker. So we decided to use a fuzzy logic approach in order to set a number of rules to connect the two sets of variables. So, for example, if the age of the patient is less than 4 years and the weight is less than 10 kilos and the growth factor is a particular value, we can select the single chamber pacemaker. So you can see that from the patient characteristics, with some rules, we can select the related technical characteristics. At the end of the fuzzy logic approach, the output of this approach is a number of per each technical characteristics of pacemaker, a percentage value. This percentage value represents the ability of the single technical characteristics to address the clinical question about the patient. And this is the whole process. And now, so starting from the patient clinical characteristics and the pacemaker clinical characteristics, through a fuzzy logic algorithm, we obtain a percentage score for each pacemaker technical characteristics, and crossing the data within the database built before, in which each model, pacemaker model from different manufacturer was described with respect of the same technical characteristics which are associated a percentage score, we can identify the model or the limited number of models which perform better and which reflect the clinical question under evaluation. So,
Martina, 4 minutes more.
Yes. In conclusion, this is the last slide. In conclusion, we can expect from a clinical point of view, an optimization of patient-specific pacemaker selection process and related clinical pathways, because with this mathematical approach, we intended to model the current decision-making process of a physician in the selection of a patient-specific device, and the improvement of clinical result quality accordingly to clinical needs in order to maximize medical devices' clinical effectiveness. So in conclusion, we can say that the analytical decision-making algorithm will provide a useful support tool for the multidisciplinary evaluation processes, which will be helpful in standardizing the decision-making process. So it provides a quantitative and repeatable result, and for this reason, it will be able to guide and support the selection and the introduction of all innovative technologies in clinical setting, increasing in this way the decision maker's awareness. Thank you for your attention.